very excited today because we have in our clinic a very special guest, a superstar of aesthetic industry, Dr. Vincent Wong.
Oh, hi.
Hello,
Thank you.
Vincent. How are you today?
I'm good, thank you. How are you?
I'm very good, thank you. Obviously, I couldn't miss the opportunity to speak with you and find out about your success in medical aesthetics. You have been in the industry for a while,
Yes.
so could you please tell us how did it all started for you?
So for me, when I was in medical school, so since sort of like year 4, I kind of knew I wanted to do something skin related. So at that time, within the NHS system, it was only dermatology or plastic surgery. So I went for plastic surgery. So my last job in the NHS was in plastic surgery as well. But at that time, I was also suffering from acne. I had a lot of pigmented scars and things like that. So then I was looking at how I can treat my own skin, and I had like a series of skin peels and other stuff like non-invasive treatments, and that's when I found out about aesthetics and fell in love with it immediately.
Fantastic. And what is it, how in your opinion, medical aesthetic, the evolution in the industry has been incredible. So how did it change over the last 10 years? What is your opinion?
Wow, so much has changed. So in terms of sort of like technology, research and development, so obviously there are more products available these days, more treatment modalities, more energy-based devices that can target different layers of the face. And then in terms of clinical approach, when I first started, it was pretty much wrinkle chasing. So we choose one area and get rid of the wrinkles and things like that. Whereas now it's more holistic. We look at different layers of the face, we look at the entire face as a whole, and also the wellness side of things, because I think aesthetics should be part of a bigger conversation surrounding wellness, mental health, physical health, nutrition, and the whole holistic approach.
Well, like one of my patients said, there is no point in having great body without a beautiful face. So
Exactly.
it's all complement each other.
Absolutely.
And what do you think will be the next big thing in medical aesthetic? What do you think where aesthetic will move on over the next 5-10 years?
Yeah, I think threats would be a big thing, for sure, because I think a lot of people obviously are very familiar with dermal fillers now, and it's a great product, a great treatment to actually restore lost volume. But I think sometimes when patients lost a lot of volume and there's like soft tissue migration, fillers can sometimes make their face look a bit too big. So I think threats, especially those made with polycaprolectin, which last a little bit longer, can effectively reposition those tissues. So then we reduce the use of dermal fillers, and therefore we don't give the patient a huge face.
Yeah. And can you tell us about, in your opinion, what has been the biggest success so far in your aesthetic career? Obviously you're very successful, but what you would like to highlight?
Oh my god, I think probably for me, if I were to pick one, would be writing and launching my textbook. So yeah, I had a textbook released 2 years ago with CRC Press called Decision Making Aesthetics Practice. Yeah, so that was a highlight in my career, you know, being able to share my knowledge with colleagues all over the world. So yeah, that was a huge moment for me.
That is amazing, and what coincidence, because I have my book launch tomorrow.
Oh my god, congratulations!
So, but this book is orientated towards the patient,
Okay.
and it explains all the barriers, obstacles, decisions behind aesthetic treatment. So it's called Beyond the Mirror. I didn't know that you had this. So fantastic.
That's amazing.
What a coincidence.
Yes. Oh wow. How did you find writing it all up?
It was a long process,
Yeah.
so it took us in total 2 years.
Yes.
A year of writing material and a year in production, but now finally it's with us, so I'm super excited about tomorrow.
Wow.
Well, very interesting, isn't it? So, Vincent, and the very last question, I hope you don't mind me asking it. You look fantastic, but you're also so experienced, and I couldn't put the age on you. How old are you, and what is your skincare secret?
Okay, have a guess.
Well, you're probably very good with your skincare routine.
Yeah. So I am 37, and my skincare routine basically, the one thing that I cannot live without is SPF. So by SPF in the morning, afternoon, and even in the evening as well. And I always educate my patients to do the same because obviously indoor lighting, mobile phone screen has UVA as well. I do like a skin peel once a month. Just to keep my face and my skin looking fresh. And apart from that, it's just using active ingredients like vitamin C, for example, and salicylic acid face wash.
Well, I'm sure who will be watching this video will pick up all the tips from you for skincare. Thank you so much. It has been a pleasure.
Thank you so much for having me.
Thank you.